different types of multivitamins out there that we kind of just wanted to focus on the eye multivitamins. They're specifically formulated for eye health. In general, these eye multivitamins are formulated based on different eye studies that were performed over the years. So with Preservision and Ocuvite are the two big brands, and you can find generics of each of those. You have AREDS 2, AREDS with lutein. The study itself was called AREDS and AREDS 2. And so each of these is formulated to match the results of each of these studies. There's just a little bit of difference between each one of them as far as different quantities of each ingredient. So it's really something that would be beneficial to discuss with your eye doctor to see if they want you on something like that. The studies themselves show that they can help prevent macular degeneration down the road, but as far as treatment of glaucoma, that's best left for a prescription. We've got vitamin A. So vitamin A is usually what people think of as they're thinking of eye health. A lot of times you can find this in a multivitamin, or you can just get it by itself. Vitamin A generally, like I said, is good for vision, but it's also good for cells, cell growth, reproduction, and then also helps your immune system just a little bit. For most of these supplements that we're going to talk about, food source is best to absorb it. With supplements over the counter, which is great, it's a great way to get a supplement, especially if you can't tolerate a certain food that is available as supplements are great, but across the board, it's recommended if you can add these to your diet somehow. So each of these slides, I'll include what food sources are available for each of them. So we would want to focus on spinach, dairy products, liver, leafy vegetables. So anything that's leafy, green is what we want to focus on. Carrots and cantaloupe are the big sources of vitamin A. And this would be recommended generally for people who have a limited diet, pancreatic disease, eye disease, or measles. We've also got some side effects that can come from vitamin A. And I'm sorry, it looks like maybe there were some formatting issues with the slides. So with our vitamins, generally the side effects won't really occur until you get a much higher dose, but we can experience some nausea and vomiting, potentially some vertigo, blurry vision, some liver damage. So we've also got plenty of B vitamins. So we've got BU is thiamine. We've also got riboflavin. And sorry, we might just see if I can plug the flash drive in. It's cutting off. Sorry, quite. We might plug the flash drive in and see if we can upload it. We've got vitamins B through 12 on this slide. It looks like it was formatted differently. Mind if we give that a shot?
I can try that, I'm not sure.
All right, we're going to give something a shot real quick here.
That's going to do it in a different. Oh, I can't do it because I can't unplug this. I can't.
Okay, what is this open with right now?
It's PowerPoint.
Okay.
I'm sorry, we're gonna just have to kind of power our way through it because I don't have any other plugs.
So that's okay. So we've got plenty of B vitamins, and we'll, again, sorry for the formatting issues that we're having. So B vitamins, we've got vitamin B through 12. First B vitamin is thiamine. It's going to help us break down and release energy from food. So good food sources for this is going to be peas, nuts, bananas, oranges, and whole grain bread. We've also got vitamin B2. It's going to work very similarly to vitamin B1. Sources of food is going to be milk, eggs, mushrooms, and yogurt. Vitamin B3 is niacin that we can get from meat, fish, wheat flour, and eggs. Vitamin B6 that we can get, and then vitamin B7. Let's see if I can pull up the rest of my slides here. Talked ahead of time, we were going to turn everything into airplane mode. It's hard to download slides in airplane mode.
Know how to change this formatting in any way.
No, that's okay.
Okay.
That's okay. Fortunately, there's only a few slides that would have been formatted a little bit differently. So vitamin B12, cyanocobalamin is the biggest one that people are probably aware of. And you can get that separately. You can get most of these separately, but for most people, you get enough vitamin B just through your regular diet. It's not generally recommended to supplement your vitamin B unless you are getting some sort of blood work done and they see that you're low. But vitamin B12, cyanocobalamin, is something that if you're low enough, you can actually get an injection from your doctor and they can prescribe it. And you can either do that at home or do that at the office. But like I said, generally, I think most of the studies I showed about 98 to 99% of people for most of these supplements get enough through their diet. So vitamin C is something that me and Mr. Altman were talking about earlier before this lecture. Vitamin C is something that a lot of people will use to help promote immune system health. So as people are getting sick, you might get vitamin C. And vitamin C is going to be present in a lot of your citrus fruits. So what most people think of as oranges. And honestly, as you get vitamin C at the store, most of it's going to be an orange flavored gummy because that's going to be the most common flavor that people like. You can get vitamin C from different berries as well, different fruits and vegetables, which are going to be listed there. It used to be back in the day with different sailors and everything, it would be known as scurvy that you would get if you weren't getting your vitamin C from fruits. So we just recommend getting a good diet of fruits, and you should get more than enough vitamin C. Vitamin C, actually, if you get too much vitamin C, your body just doesn't absorb it and you end up excreting it in your urine. So generally, it's not going to be something that can be dangerous to get too much of, but it won't be incredibly helpful to get more than your necessary amount. So we've got vitamin D, and there is some different debate between vitamin D and what vitamin D is preferable. We, as people, end up getting a lot of vitamin D through our diet, but also some vitamin D through sun exposure. So the goal each week would be to get about 5 to 30 minutes a day between 10 a.m. and 4 p.m. The different wavelengths of light between those hours is best to be absorbed that way, or at least twice a week to get some sun exposure just to help with vitamin D levels. What that does is with calcium, which we'll talk about later, our body actually does not absorb calcium very well unless we have plenty of vitamin D. So it's recommended to have vitamin D levels done with your doctor about once a year or so, just to make sure that you're absorbing calcium appropriately. There are two different forms of vitamin D available, vitamin D2 and vitamin D3. D2 is actually a little bit less effective than D3, but it comes from plant sources. So if we have any vegans or anybody who don't want to partake in anything that came from meat, vitamin D2 is definitely available. It's also available in higher doses. So if you're extremely low in vitamin D, your doctor can prescribe a very high dose for you to take once a week for several months. And D3 is going to be more from animal sources and that sort of thing, but it's a higher dose. So most vitamin D you can find over the counter is going to be vitamin D3. And that comes anywhere from usually 1 to 5,000 units that you can take daily. Again, if you feel like you're low in vitamin D, it would be good to check in with your doctor so they can do some blood work and find out just how low so they can recommend a good dose for you. Which leads into calcium. So calcium is appropriate for everybody just to help with prevent osteoporosis down the road. Calcium is available in plenty of different foods. A lot of things that people have around the house is almonds, oranges, leafy green vegetables. Most people think of calcium being in milk, and that's true. A lot of milk is actually fortified with calcium, some vitamin D, and magnesium. So we'll talk about magnesium in a little bit, but milk is a good source of all sorts of different things. The catch is that as more manufacturers are trying to win over more of the population, everybody thinks that the higher dose available is the one to go with. And so these doses of calcium have increased over the years. Sometimes you can get up to 1,000 milligrams of calcium per dose. And generally, our bodies can't process more than 500 milligrams at a time. Even in this image I found of the nature-made calcium, it's 600 milligrams. So in general, we try and recommend getting 500 milligrams or less at a time and just get it throughout the day. So it gives your body a chance to process it. If you get too high of a dose of calcium, it can eventually end up leading to kidney stones or maybe some calcium buildup around the heart, increasing your chance of heart failure. And so our goal is to make sure that we can protect your bones without injuring anything else inside of you. With some people, if your calcium level is appropriate, it would be a good idea just to do weight-bearing exercises if you can, and that can build strong bones as well over time. We also have iron as a common supplement that we do a lot at the hospital. There are tons of different types of iron. What we do most often is ferrous sulfate, and sometimes we see slow Fe as well, which is designed to dissolve slowly and cause less side effects like nausea and vomiting and upset stomach. It can be deficient in a lot of people if you've been on things like omeprazole or pantoprazole for long term. So if you have any sort of acid reflux that you've been taking medicines for, it would be best to talk to your doctor and see if maybe they want you on an iron supplement as well. There's nothing wrong with being on any of those medications to help with your acid reflux, but we want to make sure that we're not depleting anything else in you as well. It is absorbed best actually on an empty stomach, but most people can't tolerate it without taking it with food. So we recommend taking with food. It's better to get a little bit lower of a dose and be able to keep it down than to absorb a higher dose and not be able to tolerate it. Something to be aware of though is a lot of iron ends up looking kind of like M&Ms. They're the same size and oftentimes similar colors. So bright green, bright red. There have been many poisonings over the years accidentally of children who find a bottle and think that it's candy and take it. So if you do have iron, we recommend keeping it out of reach, potentially locked up, but just someplace that it's hard to get to just to make sure that it stays out of reach of anybody too young to understand that it could be dangerous. And if you do suspect that anybody has taken too much iron or had some sort of iron overdose, it's best to call poison control right away so they can walk you through what to do with that. So magnesium we talked about earlier, and there are lots of foods that are fortified with magnesium. So some breakfast cereals, milk is fortified. There's also, of course, leafy green vegetables is something that's going to pop up all the time. And then foods containing dietary fiber, so lots of fruits, some vegetables as well. Magnesium can do a lot of things. A lot of people is on magnesium to help with leg cramps. So you might have had a doctor recommend it for that. And it could help with migraine or headaches. And so we've got lots of patients who are on magnesium supplement for that. Magnesium can also help with constipation. So it is used for all sorts of different things, and there's many forms of it available. Magnesium chloride and magnesium citrate are more absorbed in your body. And so those are usually the ones you would want to take if you're trying to raise your magnesium levels. Magnesium oxide and magnesium sulfate are less absorbed. And so they tend to make it to your colon and your intestines. And so those are used more to help with any constipation problems. But if you have questions when you get to the pharmacy to purchase some of those, you could always ask the pharmacist there and they can help you pick one out. People who are generally at higher risk of magnesium deficiency are people with GI diseases, so like Crohn's disease or celiac. Again, because sometimes they don't tolerate some of the foods that contain magnesium, or they just don't have food in their system long enough to absorb the magnesium appropriately. And also people with type 2 diabetes, people with alcohol dependence, and older adults in general are just at higher risk of magnesium deficiency. An interesting thing that I found while researching this is that there are some people with troubles controlling their blood sugar, that if they take a magnesium supplement, it can help control blood sugar as well. They haven't really come to a conclusion if magnesium helps with the blood sugar, or if there's just some other link that they're trying to figure out. But your doctor may recommend that as well for you. So we've also got potassium, and a lot of people, of course, the first thing you think of with potassium is bananas. And that is a good source of potassium. You can also get potassium in sweet potatoes, is surprisingly high in avocado. Same with spinach and cantaloupe. But Potassium is good for both muscle contraction and help maintaining normal levels of fluid inside of our cells. So as far as muscle contraction goes, it's important to not get too much potassium, or else it could end up leading to heart arrhythmias. And so generally, we don't recommend a potassium supplement unless you have blood work from your doctor and have your doctor suggest potassium. Most of our patients are on a potassium prescription, which is a much higher dose than what's available over the counter. I believe the statistic that I saw said over the counter potassium is about 2% of what the prescription strength would be. So it's very hard to get a very high level of potassium over the counter. So if you do need a potassium supplement, it's best to check with your doctor and then they can give you a dose that would be appropriate for you. There are some medications that may be familiar to some of you that can either raise or lower potassium. So if you're on a water pill, some water pills can lower your potassium, but some blood pressure medications and pain medicine can also raise your potassium. So if you're on either of these things, usually we recommend getting it checked about once a year or more frequently, depending on what your doctor recommends. Also got zinc that is available over the counter. Zinc, a lot of people will recognize from different cold remedies and that sort of thing. Zinc is added to quite a few things. It used to be that you could buy Zicam, which was kind of like a nasal swab that you would go around the inside of your nose, and that actually over the years was found to have the possibility to get rid of your sense of smell. So if you have not seen Zicam as a nasal swab on the shelves in the last 5 to 10 years, it's because they've all been pulled because nobody can smell anymore after using it. But zinc as a tablet is still safe. Most people get enough zinc in their diet that they shouldn't need a supplement. But any sort of cold remedies that you find with zinc, generally the dose is small enough that it doesn't cause an issue for you. There are some antibiotics though, especially as we head into cold season. If your doctor puts you on an antibiotic, it can prevent the antibiotic from working well. Essentially that zinc sticks to the antibiotic in your stomach and prevents you from absorbing it. So if you get started on an antibiotic this cold season, check with your doctor or pharmacist before starting any over-the-counter supplements to maybe help with those symptoms as well. Echinacea is another thing that going into the cold season, a lot of you probably have heard of or will consider using. Evidence that we've been able to find shows that echinacea might slightly reduce your chances of catching a cold, but once you get a cold, unfortunately, it does not do much for you. So if you're sick, it's best to go ahead and just treat the symptoms you have, but echinacea hopefully will not be a part of your regimen. It won't do much for you. The good thing though is that the risk of interactions if you're taking echinacea is pretty low. So if you do end up wanting to use echinacea, you shouldn't have to worry about interactions with anything. It is still good to go ahead and check with your doctor or pharmacist before starting it. We've got ginseng. So a lot of people will use ginseng mostly as a source of an antioxidant. It also supports energy and focus and immune system health. You can buy ginseng sometimes as like a chewable, sometimes just as a capsule over the counter. It really just depends. There's all sorts of different products that you can find. Unfortunately, there are quite a few interactions to worry about with ginseng. So if any of you are on any medications to help with heart rhythm, many diuretics, blood pressure medications, or if you're on a blood thinner especially, it's important to be very cautious when starting ginseng. It's not that you can't have this item, it's just that we want to make sure that it's going to be safe and appropriate for you. So check with a doctor or pharmacist before starting it, just so that we can check on the interaction and make sure that you're getting an appropriate dose of your medication as well, so that it's not too high of a dose and causing any side effects for you. Garlic is something that we incorporate into many people's diets, and there's also, you can get a garlic supplement. Most people consider using garlic to help with cholesterol levels. So both your total cholesterol and your LDL, your low density cholesterol, can be lowered with garlic. It usually takes about 2 months for that to be effective though. It can also be used for high blood pressure, but they're still trying to figure out just how helpful that is. Some people over the years have considered using garlic to help treat GI cancers or help prevent that. And unfortunately, the studies so far have shown that that is not something that would be very helpful. Of course, side effects with garlic include breath and body odor, heartburn, and upset stomach, which if you use it in your diet or if you use it as a supplement, can happen. Garlic supplements also can increase your risk of bleeding. So if you're on something like warfarin or any other blood thinners, garlic through your diet, if you have it like on garlic bread or through some sort of pasta or something is fine. But if you're going to supplement with a tablet or capsule, best to check with your doctor or pharmacist first. Ginkgo biloba is something that people have used for all sorts of things over the years. There's been lots of claims for ginkgo. People have used it to help with anxiety, allergies. People have used it for dementia and eye problems, ringing in the ears, different heart problems, MS, seasonal affective disorder. The list goes on and on and on. And unfortunately, there just hasn't been a lot of evidence in support of ginkgo biloba. So that's not to say that some people haven't benefited from it, but just so far, the evidence that we've collected through different studies has shown that it is not very helpful for most people. It is generally safe to take if it's been well prepared. So most of the supplements you get over the counter as a capsule or a tablet, those are going to be fine. It's if you go to harvest it yourself and don't cook it properly or that sort of thing, that it can be dangerous. So just stick with the over-the-counter supplement versions of it. I don't recommend growing ginkgo biloba and trying to prepare it yourself. It does have some side effects such as headache, upset stomach, but the big ones that we want to worry about are increased bleed risk and interaction with anticoagulants. So just like the last few supplements that we've talked about, if you're on some sort of blood thinner such as warfarin, something like Eliquis, we just want to be careful and make sure that you discuss it with the doctor or pharmacist before starting. So we've also got turmeric and curcumin, and this is another item that you might notice from your diet. A lot of turmeric you'll notice is yellow, or it could stain your fingers or your countertops or your cookware if you're cooking with it, which is great. It's delicious, and it's used for all sorts of things. So people have tried to use it over the years for arthritis, digestive disorders, respiratory infections, allergies, liver diseases, depression. Unfortunately, they just haven't been able to study it very well. Curcumin, which is the active component of turmeric, just is not very stable and doesn't allow researchers to isolate it. As soon as they start testing it, it ends up turning into a different ingredient, and it's hard to really track where it's going and how helpful it is. So at this point, it's not considered dangerous to use it or anything. Just there's not much evidence out there to support it being used for much of anything. Elderberry is another big thing that you're going to be seeing people use throughout the cold and flu season coming up. Elderberry is a lot of times used to treat cold and flu, and recently it's been pushed to treat COVID-19, which is not something that I had really heard of, but had found quite a bit of talk about online leading up to today. So research does show that elderberry can help relieve symptoms of flu and some upper respiratory tract symptoms. Infections, but there hasn't been any evidence that it can do anything for COVID-19. So at this point, we recommend, of course, if you have a COVID infection, reaching out to your doctor and letting them know so that they can monitor you for symptoms and prescribe something that has been proven to be effective for treatment of symptoms. Elderberry juice, a lot of people will use as well. I've seen that you can get at pharmacies, and you can usually take about a teaspoon, either mix it in with another drink or just do a kind of like a little elderberry shot in the morning. And that's generally safe to use. This is another plant, though, that if you try and grow elderberry on your own, you have to be careful and make sure that you prepare it appropriately. If it's not cooked appropriately, the berries can end up causing severe nausea and vomiting and diarrhea. Ginger is another thing that people might incorporate into their diet. Again, all of these things are recommended to incorporate into your diet if possible, but if not, supplements are usually appropriate. So ginger, we oftentimes will find people using ginger for nausea relief, sometimes as an anti-inflammatory, sometimes for bloating and gas, and sometimes as an antioxidant. But usually nausea relief is what we see as the biggest thing. And as you can see, this bottle is labeled to help with motion sickness as well. It has been proven to be helpful for nausea and vomiting associated with pregnancy. Unfortunately, most of the studies I can find show that it isn't very helpful for motion sickness. So while it does help with nausea from pregnancy, nausea with chemotherapy drugs, not nausea from your road trip that you might be taking for this Thanksgiving. As far as the anti-inflammatory, unfortunately, there's just not enough evidence to prove whether it's effective or not. And that's not to say that it's not effective, just that we can't say for certain that it is. Of course, anybody who has had ginger in the past may have been able to tell you if they've had abdominal discomfort, heartburn, diarrhea, and some mouth and throat irritation. But generally, ginger is pretty well tolerated. Caffeine is a supplement that we see mostly with college students and younger people, but we did want to bring it up just because it can be dangerous. We recommend using it with caution because of the abundance of side effects and potential for heart arrhythmias that could come from this. The caffeine tablets that you can find over the counter are generally about 200 to 220 milligrams, but you can also find caffeine powder that some people will add to either coffee or different drinks to help with alertness during the day, to help with fatigue. It just depends on the situation, but it's very easy to end up getting more caffeine than you realize. Most cans of sodas have about 65 milligrams of caffeine. So if you think about it, the one little tablet that you take is equivalent to about 4 cans of soda and what you could get from that. So if you think that you are a little bit jittery after a can of soda, just know that the caffeine tablets might not be the way to go. But caffeine overdose, a lot of people will have very high heart rhythms and jitteriness, sometimes anxiety, and just be more combative than usual, just as people are kind of working that through their system. And we've got tryptophan and bonus points to anybody who can tell us what tryptophan you might be experiencing soon.
Oh, turkey.
Yes, yes, we've got somebody in the audience here. Tryptophan is going to be found very commonly in turkeys. That's what everybody kind of jokes about for Thanksgiving. And of course, what that can do is cause some drowsiness. Is the big side effect from tryptophan. So everybody has their turkey Thanksgiving meal and everybody takes a nap right away after. Tryptophan is going to be an amino acid, so a type of protein that some people will use to treat PMS symptoms, sometimes depression, and sometimes insomnia. It's not very common to be on tryptophan by itself. Generally, it's safe to take for up to just a few weeks, but unless your doctor is recommending it, we try to stay away from it. There are some antidepressants that work by increasing a hormone called serotonin, and this can also interact with that and cause its own increase in serotonin. So we just want to be careful if you're on any sort of antidepressant to double check with your doctor or pharmacist before starting this. Also, if you're taking melatonin, both of these can cause drowsiness. So be careful if you're on melatonin. We don't want you to get drowsy and end up stumbling or tripping or anything like that. I've also got glutamine, which is going to be a type of amino acid, also a type of protein. Generally, this is going to be something that you can find as a tablet or in protein powder, and is oftentimes started after an injury or some sort of illness to go ahead and promote healing and recovery. And it can also be used to help with inflammatory bowel disease as well. Of course, with most proteins, you can find it in beef, pork, poultry. You can also find it in some milk and yogurt, different cheeses, spinach, parsley, cabbage. Glutamine is actually the most abundant amino acid in the body. So most people end up not needing glutamine because you've already got plenty of it in your system. It's only if you have done something recently that would lower your glutamine reserves that you should start this. So generally, if you have been injured, if you've had some sort of surgery or infection, or some sort of prolonged stress. So if you've just had a lot going on for several months, sometimes your body can just kind of get worn down. That would be something that you'd want to talk to your doctor about, maybe starting a glutamine supplement just to help kind of recover from that. Other things to kind of keep in mind if you've got a history of kidney disease, liver disease, seizures, or cancer, it's maybe not a good idea to start glutamine. Unfortunately, some cancers kind of feed on glutamine. So if you were to take a supplement, depending on the cancer, you might actually be unfortunately promoting the cancer to spread or grow. We've also got probiotics. So probiotics are a big thing, and you could have cheap probiotics, expensive probiotics. There's all sorts of probiotics. Probiotics designed for pH balance, probiotics designed for people who can't tolerate dairy. So there's all sorts of probiotics out there in the world, and I wouldn't say that there's a bad probiotic. A good gut biome can do all sorts of things for you. It can help boost your immune system. It can help you break down certain foods and different nutrients and help you absorb those so that you're healthier in general and more regular. Now, of course, you could also get probiotics from food sources. So sometimes we see people use yogurt or cottage cheese, miso soup, and kombucha. For those of you that haven't used kombucha, that oftentimes will have some sort of live culture in it, which can be helpful for people if prepared appropriately. And then sauerkraut and pickles. Generally, probiotics are very safe to use, especially if you've been on an antibiotic. So antibiotics can go in and kind of wipe out good gut bacteria that help you digest things. And so that's why you might have diarrhea after taking an antibiotic, is because your good bacteria that normally help you digest things aren't working as well as they have before. So probiotics can go in and help replace things that things like antibiotics, even though helpful, could wipe out. It is possible, though, that for a few days after starting probiotics, that you could still have side effects such as gas and diarrhea, just as your system starts to kind of heal itself with your new gut flora. So we've got omega-3. The most common type of omega-3 that we see over the counter is going to be fish oil. There's also things like krill oil that people will use, and there's really not any sort of large benefit to switching types of oil. The big thing that we're going to look for in any of our omega-3 supplements is going to be EPA and DHA, which you can kind of see under there for food sources. And that's mostly comes from seafood. Essentially, these are going to be long chain omega-3. So they're just going to be kind of a more wholesome omega-3, whereas the ALA is going to be shorter chain and just less effective for you. People will be on a fish oil supplement, though, to help lower triglyceride levels, so a type of cholesterol, and help with symptoms of rheumatoid arthritis. The help for rheumatoid arthritis is less evidence behind that, but it could still be helpful if used appropriately. Unfortunately, with most fishy things, it can leave an unpleasant taste or fish breath, and then bad swelling, sweat. So the things to look out for when you're purchasing an over-the-counter fish oil, we try to get at least 1,000 milligrams of EPA and DHA. So in this bottle, where it says 1,000 milligrams, there's actually just 300 milligrams of omega-3. So just be sure to look at the ingredients to make sure you're getting an appropriate level of the effective ingredient. And if you can find either a burpless fish oil, that would be helpful, or you could always freeze the capsules, and that will help cut down on side effects as well. So glucosamine and chondroitin is something that we get a lot of questions about. And this would be something that anybody from a young age to an older age might use to help with joint health and limit joint pain. There really are no interactions of note to be aware of. We see lots of people take glucosamine with chondroitin. There is evidence mostly behind helping with arthritis knee pain. So if you've got arthritis in the knees, it may be worth looking into starting something like glucosamine and chondroitin. Unfortunately, the time it takes to be effective just ranges pretty wildly from person to person. They found that some people it's effective within a couple of weeks, but unfortunately, some people could take a couple of months for it to really be very effective. Generally, we recommend being on it at least 2 months before deciding whether or not it will work for you. But arthritis of the knee is the most effective thing that they found it for. They did not find much evidence for anything outside of the knee. We've got CoQ10. CoQ10 is something that you may be on if you're on a statin, or something if you've got heart failure. Most of our patients on statins, though, we recommend it for. Statins can end up decreasing. So statins, I guess, if you don't know, are for cholesterol. Statin can end up decreasing the level of CoQ10 in your body, which can increase the side effects from statins. So some of you may have been on a statin before and ended up developing some achiness, either in your legs, sometimes in your arms. and then gone off of the statin or tried a different statin. And sometimes starting a CoQ10 supplement can limit those side effects from statin use and allow you to continue using something to lower your cholesterol. Unfortunately, the CoQ10 that you get from your diet, whether it be from meat, fish, or nuts, usually isn't enough to supplement the CoQ10 on its own. So if deemed necessary, CoQ10 is something that we would recommend getting a supplement for over the counter. The side effects of abdominal pain, nausea, vomiting, diarrhea, insomnia, fatigue, all the sorts of those things generally are very uncommon. It's generally pretty well tolerated, but those are just things to look out for. Unfortunately, like a lot of other supplements, though, it could interact with your blood thinners. In this case, maybe reducing the effectiveness of blood thinners. So it's something to discuss with your doctor to make sure that you're on the right balance of medications. Another thing that we get lots of questions about is Prevagen. Prevagen is something that has been around for lots of years, and there are lots of claims by the Prevagen company. The biggest claim is that they can boost memory recall and improve brain function. So we've got lots of patients who take it. Unfortunately, though, there's just not much evidence behind it. The main ingredient in Prevagen is going to be that apoacorin, and that, ironically, is a protein first discovered in jellyfish. So for the most part now, they grow all of this protein in the lab. They don't harvest it from jellyfish anymore. But the idea behind it is that it binds to excess calcium in the brain, and then it gets rid of that calcium to allow the brain to continue to function. Unfortunately, the studies that have been published shows that it just is not effective at doing that. Yeah, we've got some reactions in the crowd here. So there were 3 studies that have really looked at Prevagen. The first 2 that they did that showed that it was effective actually were never peer-reviewed or published. And those are the ones that they end up citing for all of their claims. The one study that was published in 2016 that was peer-reviewed was the one to find that there really is no benefit to it. Another thing to be aware of is that Prevagen also contains vitamin D. So if you're taking Prevagen, you probably don't need a vitamin D supplement also. It really does not advertise that vitamin D is included. So just be aware of that you just don't want to be doubling up on anything. The big thing to be aware of, if you are taking Prevagen, I'm not trying to get you off of it, just be careful where you purchase it. This last year, actually this month, there was a lawsuit from the Prevagen company against several companies on Amazon for selling counterfeit products over the last few years. So they sell them from what I can find under brands like Walgreens deals, CVS, like they try to make it sound like it's from a legitimate pharmacy company. So just be careful where you're purchasing it from. Best to purchase at a local location if possible to make sure that you're getting it, or from the Prevagen website directly.
Bit of a medicine that doesn't work.
Right. It's a big seller. Melatonin is something that we've got a lot of patients on, and melatonin we see anywhere from children to adults that use melatonin. Melatonin is a hormone in our brain that is produced naturally, especially as it starts to get later in the evening. So as it gets darker, our melatonin levels will go up to help promote sleep. Some people just unfortunately are not very good at producing melatonin. And as we've gotten to be a more technologically focused people, our melatonin levels have started to go down because looking at our screens at night actually can block melatonin production. So we do recommend melatonin if you discuss it with your doctor ahead of time just to see if that's appropriate for you. It is possible as you get older that melatonin stays in your system longer. So we do recommend going ahead and either starting on a low dose melatonin and working your way up, or discussing with your doctor first to see what dose you should start at. Fortunately, over the counter, it ranges from 1 milligram up to 10 milligrams. So it can be kind of hard to decide where to start. Most people will start with anywhere from 3 to 5 milligrams. That's okay, we'll go back. There we go. So that's good. So we've also got St. John's wort. This was recommended that we talk about by a therapist here in town. It's been a while since I've known anybody to be on St. John's wort, but a lot of people will use this to treat mild to moderate depression. So you could use it for that, and it's actually been shown to be effective for mild to moderate depression. It can sometimes also help with menopausal symptoms and somatic symptom disorder. So if you've got different sorts of physical sensations, whether that be painful or not, it can help treat that. Unfortunately, there are a few side effects. It can interact with antibiotics that cause photosensitivity. So if you're taking an antibiotic, you'll want to check with your doctor or pharmacist first, just to make sure that you're not extra sensitive to the sun. And it's not that bad in the winter when most of us are indoors and not exposed to the sun. But if it's during the summertime, especially, it could put you at risk of sunburn or skin cancer. And unfortunately, as you can see on the slide now, the drug interactions actually go off of the slide. Originally, the formatting showed it was 3 different columns long. There are tons of interactions with this medication. So if this is the only thing that you're taking, generally it's pretty safe. But if you're taking any medications at all or supplements over the counter, it's important to check with your doctor or pharmacist before either starting or continuing it, because it can cause unsafe levels of different antidepressant medications, cholesterol medications, pain medications, lots of interactions with blood thinners. So all things that are very important, but we don't want to end up causing any problems with the medications that you need by taking something over the counter. So now that we've gotten to the end here, we've got 3 different companies that have programs to evaluate the safety and efficacy of supplements over the counter. We've got Consumer Lab, we've got NS International, and we've got the USP, which is the United States Pharmacopoeia. So what these companies do is you can actually pay, it's optional, to have them check your product and make sure that your product is actually containing what you're claiming is in it. So some of these melatonin products, for example, that we have, it might say 5 milligrams of melatonin. And unfortunately, being a supplement over the counter, there's no actual required checking. The government doesn't require you to prove that what's in your medicine is actually what's in it. So I think it was somewhere around 80% of the things that were tested for melatonin had anywhere from 80% of the melatonin that it claimed to 130%. It also had up to 20% serotonin, which is what you would find in antidepressants sometimes, which was a big interaction for melatonin. So because there's not really any requirement for testing, there are some companies like these 3 that can test your product, and their label will actually be on the bottle. On all of my slides, I try to include any products that had the USP label, because that's what you'll see most common for over-the-counter products. NSF and Consumer Lab will test more like bulk powders and that sort of thing that you can purchase. But USP is what you'll most likely find over the counter at your local pharmacy. So it's just that little stamp. If we go back a slide or 2, you can see on the bottle what that will actually look like. So Nature Made is probably the most common brand that you can find that has USP label on it. For that matter, I usually recommend Nature Made if it's available, just because they have a bigger history than other over-the-counter companies producing products that have been tested and authorized. That's great. I think that is it.
Let me stop sharing here, because there is a question in the chat, and I want to get to that. This is from Shelley. She goes, "My doctor told me that recent studies do not support the efficacy of fish oil."
Sure.
So she's asking.
Yeah. And there are lots of studies out there. Honestly, we've seen a decrease in people that are finding fish oil effective for them. What I use for all of my sources, I've got links down on each of my slides. So you're welcome to, do we send these slides out to people?
We will.
Okay.
In fact, this entire thing's being recorded, and they'll get that as well. And if you, since I have the slides, I can send the slides out separately as well.
Sure. Yeah, that's great. So you're welcome to look at the sources on that too. Unfortunately, there are just lots of studies for all sorts of things that show that things could be effective or things could not be effective. I'm definitely not going to dispute what your doctor has told you. If your doctor does not support the efficacy of fish oil, then I agree with that. There are going to definitely be studies that show that it's not effective. And I agree that there are probably much more effective ways to treat cholesterol or triglycerides or anything like that than a lot of these supplements over the counter. Most of these supplements, honestly, will be used by people who are trying to avoid prescription medications, which is fine. I understand wanting to do that. So there may be some evidence behind it. There's probably much more evidence behind something much more effective. And I know that's not a direct answer to your question, but it's just a hard thing to answer.
I will draw out from my personal experience. I take fish oil for my eyes, and I've had 3 ophthalmologists who have said it does help with moisture in your eyes.
Sure.
I have a little bit of dry eye, and it helps. That's the only reason that I take it, and that seems to work. So I guess it's also what you do it with it.
Yeah.
Okay. Are there any other questions? If so, please put them in chat. I do have one question, and that's about probiotics. My feeling is if you don't have an excess of antibiotics in your system, do you need probiotics, or are you effectively harming the balance that's already in your system? So I tend not to take that stuff because, and yet, you see advertisements every day that, you gotta take probiotics. So.
Yeah.
Am I crazy or?
No, and generally we at the hospital recommend probiotics if you're going home on an antibiotic, or if you have some sort of health condition that prevents you from digesting foods appropriately. There was a pharmacist that I worked with as a student who was very big on over-the-counter sales and would oftentimes make the claim that the right probiotic could change somebody's life. And that may be true, but generally probiotics are not something that I recommend for very many patients. If you're having an unknown reason for some gas or bloating, or you've had some constipation or diarrhea, probiotics can oftentimes help your body push things in the right direction without taking like a stool softener or something like that. But in general, probiotics is not something that we recommend for everybody.
Good. I don't see any more questions. If you have any more, please put them in the chat. And here's one. Any thoughts on EDTA for heavy metal reduction? How about use of colon cleanse protocols? I have 2 questions.
Yeah, that's okay. Unfortunately, I don't have much experience with EDTA, so I probably will avoid talking about that just from lack of knowledge on that. As far as colon cleanse protocols, there's quite a few different colon cleanse protocols. The ones that we do most often. Okay, I'm going to keep answering the previous question and move on to Mr. or Mrs. Wallace here. But colon cleanse protocols that we will work with at the hospital are done prior to a colonoscopy. So it's done under the recommendation of a doctor. It's going to be sometimes magnesium citrate, sometimes polyethylene glycol and bisacodyl. Those are all just done for the sole purpose of cleansing the colon so that they can get in and take a look and make sure that there's nothing inappropriate or alarming there. But I don't know about colon cleanse protocols for any reason other than that, whether that be for personal use or anything like that. Garlic, onions, etc.
Prebiotics.
Are these recommended to feed the probiotics? Sure. So there has been kind of a movement, especially in the last couple of years, of taking things like prebiotics. Yeah. So these are all very good questions, and that's fine. If you type anything out, we'll just keep working through the questions that we have. So feel free to type questions, even if we're not done with one yet. Prebiotics, especially in the last couple of years, we've seen the rise of something like prebiotic soda. And so essentially what it is exactly what it sounds like, is it contains different products and different concentrations of things to help promote the growth of the good bacteria that's already there. And it doesn't contain any sort of probiotic or anything like that, but rather it's designed to help promote the growth and effectiveness of the gut bacteria that are there already. So as far as whether they're effective or not, I'm sure that they do some good. I haven't heard of people using garlic or onion as prebiotics previously, but that doesn't mean that they aren't effective for that. And I wouldn't tell you to stop using those for sure. But I do know some people that use prebiotics and they say that it makes a difference. I've not personally looked at any sort of studies or anything like that on it. As far as preferential to get vitamins in our diet without using supplements, it's very much preferential to get supplements via your diet rather than taking something over the counter. Our bodies just naturally absorb it much better. So, like I said earlier, about 98 to 99% of us get what we need through our diet without the need for supplements. The supplement industry is a giant business that is designed kind of to make money while also doing some good. But most people probably with a proper diet get what they need without needing any supplements. Fortunately, most supplements don't do a lot of harm if you were to take something, so it's generally safe to be on supplements. But yes, we do prefer both for absorption purposes and for safety purposes that you get it through your diet if possible. But not everybody is able to eat certain foods, whether it be because they have an allergy to it or they prefer to avoid certain products, in which case it might be good to supplement. Recommended probiotics for UTI prevention. I'm sure there are a few different probiotics specifically for that. And I'm trying to think of the name of the brand that we have at the pharmacy, and of course I'm blanking on it. But like I said earlier, there are tons of different types of probiotics, and some of them are specifically formulated with different bacteria to help prevent different things. So I'm sure there's at least a couple different ones for UTI prevention. And there's other products as well that you could use over the counter. A lot of times cranberry is used as a supplement to help prevent UTIs as well. It can increase the acidity in the urine to help kill bacteria more easily. Make a difference in some supplements, whether you take them in the morning, the evening, or split the morning and evening. That's a good question. And so it really just depends on the supplement that you're using. And I'm sorry, I kind of muttered that question to myself. I'll read it louder out loud. But does it make a difference in some supplements, whether you take them in the morning, the evening, or split them morning and evening? And it just depends on the supplement. Things like melatonin, you definitely want to take in the evening because it's designed to help you sleep. Most supplements, though, it really doesn't matter when you take it. A lot of them, we prefer that you take it with food just because sometimes it helps with absorption. Vitamin D, especially, we absorb better if you take it with food. But it doesn't really matter if you take it in the morning or the evening. Of course, if it's something like caffeine that we discussed, you're definitely going to want to take that earlier in the day to prevent you from being able to fall asleep.
Any other questions? Okay, any questions here? Nope. I think it's time to thank Dr. Pope for joining us. I appreciate it. And I know most of you are muted, but they are applauding, and we really appreciate it. So we'll see you all at the next whichever event is coming up. I know we have a few less things coming up in the short term because of the holidays, but rest assured, we have plenty of things for you coming up over the next 3 to 6 months that you'll have plenty of things to do with the group. So thank you all for attending, and we'll see you next time. And thank you, Dr. Pope, for this very informative session.
Thank you, everybody.